Sridhar. Welcome to my channel. If you have not already subscribed, I request you to subscribe to the channel and do comment to share your thoughts as well. Appreciate it if you share the videos you find useful with your friends, relatives and colleagues as well. I had discussed in one of the recent videos about symptomatic treatment for colds and why we should avoid medication as far as possible. In this short video, I will try to cover which situations need nebulized treatment. In most countries, nebulization is becoming more popular for whatever reason. So one of the main factors, it's easy to use. The parents feel more comfortable that they are doing something active to treat the baby's condition, and possibly there is some benefit which may not change the outcome, but the parents feel there is symptomatic relief at that time. The negatives obviously are the cost of the treatment, the noise involved, and the need for being clean with the process, because the nebulization, the nebulizer, if it's not cleaned properly, if you're not taking the hygiene precautions, that in itself can bring infection. So it comes to the question of, do we really need to use it, and when do we need to use it? So there are some situations like bronchiolitis in an infant where there is breathing difficulty. The nebulized hypertonic saline has been shown to have some benefit. It doesn't change the duration of the illness. It may give some symptomatic relief. So it is a symptomatic treatment in this stage. But it is not essential. Keeping the room reasonably humidified, supporting the feeding, keeping the nose patent is adequate. However, when the baby has a repeated chesty cough, if the parents insist on having some form of treatment, it's okay to use nebulized saline, mainly the hypertonic saline. It might help, but if it doesn't help, the child gets more agitated. Also inform the parents that continuing the treatment doesn't help, because an agitated child coughs more as the airway becomes narrower. Using medications like bronchodilators, Ventolin is an example, salbutamol, in babies with bronchiolitis is not clear-cut evidence-based. There are some babies with wheezing are associated with the bronchiolitis, but remember that the wheezing that happens in bronchiolitis, which is a viral infection causing chest infection in young babies, is mainly the narrowing of the airways with swelling. The wheezing that happens in asthma is because the airway becomes narrow with reactivity. The muscle itself becomes tight, and this kind of reactivity responds well with bronchodilator treatment, which is salbutamol nebulization or inhaled treatment. However, in bronchiolitis, it's a swelling of the airway. The airway becomes thick. It's edema, which is a fluid which leaks out, and that makes the airway swollen. That causes a narrowing. So we need to give it time to improve. And giving the bronchodilator in this kind of a wheeze doesn't help. And we should remember that salbutamol is not an absolutely safe medication. It can cause a fast heartbeat in the baby. It can change your potassium balance, so make the effort of breathing a little more difficult if the muscle is not strong enough. It can cause agitation in the baby, and obviously if a baby is already having reflux, for example, the salbutamol may increase the reflux as well in these babies. So it's not a totally safe treatment, and think twice before you consider using it. Unfortunately, many parents are used to using it for viral wheeze, and they tend to extrapolate and use it for the young infants, which doesn't always help. Nebulized steroid is another factor. Again, it's commonly used for acute exacerbations, and as we know, if the child has asthma and you're going to use steroid, use a higher dose like prednisolone. And if the child has a viral infection like bronchiolitis, the use of steroid is not clear-cut evidence-based. If the baby is in the hospital, you are depending on oxygen and you want to reduce the support, a trial on the nebulized steroid can be used, but otherwise routinely giving steroid for viral wheeze is not indicated. So Pulmicort is expensive and it's a steroid. It doesn't help in most of the situations. So the most important aspect is feeding support, keeping the humidity, supportive treatment. If the baby has fever, you can treat. Monitoring for serious infection is important, so check with your doctor. And small, more frequent feeds, positioning to make the breathing comfortable. Use the nasal saline frequently. Suction out only if it's essential, if there is secretion overflowing. This happens in a few babies as well. And use of saline nebulization if the child has a chesty cough, if that helps you avoid other medicines which are potentially harmful. So use it only if it seems to benefit your baby. Don't routinely use it. So the key message: don't use medications unnecessarily. Make sure if you are using a nebulizer, you clean it and you know how to use it. And don't think this is going to cure the problem. It's only going to give brief symptom relief, if at all. So don't keep giving it if there is no benefit. Your labor is more. I mean, you're working hard to clean, to nebulize, and the child may be crying in the meantime. They may not enjoy it as well. So think twice whether you really need to use it. Okay. Thank you.